All right, everybody. Thank you so much for joining our session today. Um, Today we're going to be talking about the Beaches Indicator Project, and our last session is going to focus on physical health, mental health, and healthcare access. It's the last section of the dashboard and the last meeting series that we're having this week. For those of you who don't know me, my name's Allison Ownby, but I feel like everybody on the call has been to at least one session this week, except for Joshua, but he's really familiar with Catalyst. So I'm going to just quickly go over some of the level setting slides that we've reviewed a few times this week with our audience. Um, and we'll go ahead and just do that right now. Let me share my screen and start here. All right. So I would be remiss if I didn't again thank our supporters, the Beaches Community Fund and the Community Foundation for Northeast Florida for supporting this series and allowing me to present this data to you today, as well as our partners in community, the Beaches Action Collaborative. The Beaches Action Collaborative is a group of community-minded individuals from different religious organizations, businesses, and nonprofit organizations that meet at the beach every month. They bring in rotating topics, have lunch, network, and do things like build this Catalyst dashboard, or not this North Florida Beaches Indicators project for the community. If you've never been to a session, I would highly encourage you to attend. Again, I'm Allison Owenby. I'm the Director of Data Research and Strategic Initiatives at the Nonprofit Center, and I will be leading our conversation today. So I'll go ahead and just ask everybody to unmute yourselves and introduce yourselves. I'll start with David
David Loeb Community Fund and Bean.
and then Leslie
Hi, I'm Leslie Brotman, a member of the Beaches Community Fund.
and Glenwood
Glenwood Charles, Baptist Health, Community Health and Wellbeing.
and Joshua.
Joshua Rumberger Ray. I'm here tomorrow. I'm the grant and data manager.
All right, and Alexandra.
Alexandra Reinhardt. I work with Glenwood at Baptist Community Health and Wellbeing.
Thank you. And let's see, Lori. Lori, you're on mute if you're there. No. I'm gonna say maybe Jenny's here from Jack's Care Connect.
That's correct.
Jenny, you are the director, CEO? What do you do
I
there?
am the director. Yes.
Okay, awesome. Thank you so much. And Beth is in the car, I think. Beth, can you come off mute or are you driving? Beth Collins Hymns is also with us today, as well as Lori Anderson from the Beaches
Council on Aging. Sorry, I got a call.
Council. No
Yeah.
worries, Council on Aging. Thank you. I was like, Beaches, something.
Something, yeah.
Thank you. Thank you. All right, let's keep going here. Uh, Nonprofit Center does a lot of great stuff for our community, including counseling and coaches. We have a board bank where we allow nonprofit organizations to post different board of director roles. We have a job posting board where nonprofit employees can find their next career opportunity, as well as different workshops and trainings is probably what we're most known for. The Nonprofit Center of Northeast Florida has been doing data work in our community since 2022. We started when we started the Northeast Florida Indicators Project, and which has since evolved into Catalyst. We've got lots of different regional products that we deliver that have kind of the Catalyst nomenclature associated with them. Primarily, the biggest one is our regional dashboard, that has data around 6 different issue areas in our community and also county national and regional views of the data. We've also partnered with different city council members to build them custom data views for their city council district, as well as Clay County, a specific project in Clay County, as well as the one that we're here to talk about today, which is the North Florida Beaches project. When we think about one of the biggest questions people ask when we talk about the beaches is what does the beaches geographic region look like? And so this map right here is going to kind of tell you what the geographic area we're talking about. So we have data that goes south to Ponte Vedra, north to just above Mayport, and a smaller section that's to the east of the intercoastal or west of the intercoastal. The zip codes that make up the project are here, as well as parts of these that you see over here. So as we go through the data and we kind of just do some demos with you all today, you'll get to see what that geographic area looks like and how the data changes when you look at different geographies. The North Florida Beaches Indicators Project acts as a centralized source of data, and the primary audiences we're targeting are nonprofits, government and business entities, as well as volunteers, donors, and the community at large. And we've broken up the data into 6 different focus areas. The first is overview of the beach. The second is housing and homelessness, which we reviewed yesterday. Economic vitality was on Monday. Food insecurity was Wednesday, education Tuesday, and physical, mental health, and healthcare access is today. This is what our landing page looks like. So I'm going to stop with this PowerPoint. We're just going to go straight over to the website. Now, while I'm doing this, I just want to make sure, and I know I've said this during every session, but if you have any feedback as we're going through the data, reactions that you want to share, or thoughts, please feel free to jump off mute and share them. The only way that we can make this project truly reflective of our community is by collecting your feedback. All right. So this is our Catalyst main dashboard here, our website. You can get here by navigating from the Nonprofit Center's website by going to Catalyst dashboard right here, or you can get there from navigating from the Beaches Action Collaborative website. So if you've never joined a Beaches Action Collaborative meeting, I would highly recommend that you attend. The next session is on February 17th at 11:30, hosted by Sulzbacher Center. And I heard the rumor the last time that we may do it at the Beam Garden. So as long as the weather's nice, it's a beautiful place to meet with different folks, network and connect, and have lunch. But let's go ahead and navigate over to the Beaches Indicator Project. So to get there, you're going to click on Data, and you're going to click on North Florida Beaches. And this is kind of our landing page. You saw a screenshot of it in the PowerPoint. We've got kind of a description of what the indicator project has, overviews of each of the data categories that are included in the website, as well as recognition for our Beaches Community Fund, the Community Foundation for Northeast Florida, and the Beaches Action Collaborative. Once you navigate over to the left side of the screen, you'll see a tab that tells you how to use the dashboard. And so it just gives you some quick tips on how to save data, how to embed it in your website, and then how to kind of download it and leverage the different groupings that you can see on the site. So we're going to go ahead and go over to the physical health, mental health, and healthcare section. So this dashboard is pretty simple. It's broken into 3 categories. We've got physical health, mental health, and healthcare as our 3 major categories for the data. And we have kind of breakdown sections after that. So we're going to take a look at how physically healthy people are at the beach. The first data points we're going to review are around chronic disease and poor physical health. So when we look at it and we're going to compare the beach to Duval County, we're going to see that for the major prevalence rates for chronic conditions in 2023, the beach typically outperforms Duval County overall, right? So there's lower rates of obesity. Can you make it a little bigger? Let's see if I can zoom in. Too far? Is that good? Is that better?
Thank you.
Yep. Okay, good. All right. We have less diagnosing of diabetes, less coronary heart disease, less asthma, higher cancer rates, which is interesting. Lower amounts of chronic obstructive pulmonary disease, lower amounts of strokes, high blood pressure is lower, as well as high cholesterol is slightly higher as a percentage than Duval County.
As far as the cancer thing, I'm not a doctor or anything, but I have to say the amount of breast cancer in young women between like 40 and 50. My daughter-in-law is on a tennis team, and half of the tennis team was diagnosed with breast cancer. It's just crazy,
Wow.
crazy.
Wow. Jenny, you have any thoughts on that?
No, I'm really wishing we had someone from our health and wellness program on this. I'm definitely gonna share, make sure we get some team members from that in the future because they're more tuned into this geographic region. But I know in general, breast cancer is also our highest, most frequent cancer type out of all of the cancer cohort that we have. It makes up like 80+%.
Wow.
The optimist side of me says maybe it's early detection and that's a good thing, increasing some of the numbers. But yeah, there's definitely something going on.
There's
Mm.
also a big
Oh,
increase in colon cancer, especially in younger people. That's just a national trend.
I would imagine too, and I'm not in the medical field, but skin cancer, I would think could be higher at the beach also.
Hmm.
Yeah, I assumed that that data was higher because of the beaches, but then I see here it says except skin. I was like, oh,
Oh, it
okay.
does? Oh, okay.
Yeah, it
Okay.
says cancer except skin. So I
Yep.
imagine, right, if you added in skin cancer, it's potentially,
Right.
although everybody lives in Florida in the sun.
Yes, I've been hearing a lot about really high skin cancer rates in Australia. Very, very high there.
Allison, can I ask a question about this data?
Sure.
Um, so one of the things from a medical standpoint that we would look at would be these are rates, these are reported rates, right?
Yes.
And I think that they're in fact colored by how often people go to the doctor.
Yes.
So, it's possible people at the beach go to the doctor more often or less often or whatever. And that's going to influence the prevalence rate, which is what you're talking about.
Hmm. Yes, we have that data, so we're going to
Okay.
get there about doctor visits and
Okay.
checkups and
Sorry.
even dentists, things like that. But absolutely, yes, that is included in here and absolutely influences as well as right. So, and Jenny can tell you this when we talked about health and well-being in our other catalyst sessions, right? We talked so much, and even Glenwood could probably tell you too, and Joshua, right? How health outcomes are so influenced by so many different factors from our society, whether it be income, whether it be the place that you live, whether it be, the school that you attend and how well you do, whether you're food insecure or not, right? And so just how these data points overlap each other is something that we talk about a lot when we're viewing it. Okay. But going back to some of the data here, so the majority of these data points are taken from the CDC BRFSS places. And so some of the data that you're going to see is from 2022 and some is from 2023. We made sure that we included the most recent available data that we had in our system, in all cases where it is available. So this one, poor physical health among adults, is from 2022, and we see that about 10% of Beaches Action Collaborative footprint is reporting poor physical health, while 13.3% of Duval County is. And then if we want to look from the map perspective where those people live, so where higher rates of poor physical health are presenting at the beach, we can kind of see we have some showing up in kind of Mayport north of Neptune Beach, some of these areas that are west of the intercoastal, as well as some poor physical health out in Ponte Vedra. And I can tell you, as we've been looking at the data, there's not too many bad rates of things happening out in Ponte Vedra. So it's interesting to me to be able to see that there's a pocket of pretty poor physical health in this area.
Would that be like
I
where
think that's
Vickers,
Vickers. Yeah,
Vickers? Yeah.
I think that's Vickers.
Uh-huh.
Mhm. Yeah. Let's see. There's Ponte Vedra Palm School right across there.
Yeah, that's all Vickers Landing.
Yeah. Whoop.
And then you go up right next to beach, that other darker area. That's Pablo Towers.
Yep. Mm-hmm. Yep. Okay. And then we're going to look at just health behaviors, right? So when we want to look at health behaviors, we're going to look at doctor checkups, right? So that's going back to your point earlier. The beach does have a slightly higher percentage of self-report people who have visited a doctor in the past year. So 76 versus 75. That's almost the same percentage. And then dental visits was pretty significantly higher. So when we look at Duval County overall, we've got about 54, 55% versus 65% of beach residents. Um, and then I wanted to include some data around risky behaviors for health. And so we can just see how what the data shows us at the beach versus Duval County. So the beach is on the left, Duval's on the right. We have lower rates of smoking at the beach, higher rates of binge drinking among adults at the beach. Beach people are more fun though, so I don't know if that's a bad thing. Maybe it is. Probably for long-term health it is. Um, we have a lower rate of people reporting that they have no leisure time or do no physical activity. And then a lower rate of people reporting that they get less sleep. They receive 7 hours or less of sleep. Any other thoughts about this data? All right. So we're going to move on to mental health. And we're going to talk about two different statistics when it comes to mental health. We're going to talk about suicide rates. So this data is taken from the CDC Wonder Cause of Death report in 2023 data. So this data is not available at the Beaches Action Collaborative level. It's only available at the county level. And so we can see here our St. Johns County line is blue and our Duval County line is yellow. And so we can see how over time that data has changed. So St. Johns County started in 2009 with 16.1 and is now with the latest data 14.1, whereas Duval County was 17, now is about steady, 17.7.
Interesting, the ups and downs of those years. It would be interesting to coincide, what was going on either in the state or even in our county at that time.
Yes.
And that's another session.
Yeah, absolutely. We can make a lot of inferences based on what's going on. 2021 in the height of COVID is lower, right? Which is interesting to me versus 2018. And then in Duval County, the highest is probably here, which is 18, and the lowest being in 2014.
Well, and it's funny that,
Okay.
the 2000 and, that top blue
Mm-hmm.
dot over in 2010, that was after the 2008 crash. So I
Mm,
don't know, that's
yeah.
one theory. The other thing you had said in another at the Atlantic Beach meeting was that
Mm-hmm.
this will all change come February 1st or sometime soon to be updated.
Yes, not necessarily the CDC data, right? CDC has a different publication schedule. A lot of the health data that we leverage is from CDC and other sources. A lot of the other data that's going to be updated has to do with the census, right? So the census data was released today, actually, and will be updated. What's up, Glenwood? I see your hand raised.
Is my sidewalk, do they have access to Florida charts? Because you can get death rates or counts by zip code.
We don't have it integrated in at that level at this point, but I can always upload, so that's good to know.
Yeah.
Yeah, I'll kind of echo what Glenwood's saying. There was a presentation in August that I watched. I didn't know that until August, but it's a color map. I'm looking at it right now on my other monitor, so I can share it with you, Allison. But
Sure.
looks at
Yeah.
5 years of data, and the darkest shade of purple is the highest suicide rate in Duval County, and actually Neptune Beach is the darkest shade of purple, and 32233 is a little lighter, and 32250 is a little lighter.
Will
But
you share that right
yeah,
now?
thank
Share
you.
your screen. Let us
Sure,
take a look at it. This is
sure,
why
sure.
I love these sessions. It's because then
Yeah.
I just get updated on all the good stuff.
Yeah, and there you can see like it's a little blurry the text at the bottom, but you can see they use the
Uh-huh.
Florida Department of Health, and you can
Oh,
see
cool.
it's 5 years, 2018 to 2022. But when
Ooh,
they
okay.
showed this up on the screen, I kind of like my jaw hit the floor on
Wow.
32266. Obviously, that's where we're based, and
Right.
and so I haven't had a chance to get deeper than what I saw that day, but I definitely need to for sure.
Awesome.
Did you say it's on a website called Sidewalk or a
That's
or
what we leverage is my
oh,
sidewalk.
okay.
This is
Oh, okay.
probably what Florida Department of
Florida
Health.
Department of Health.
Yeah, Dr. Joshi had this as part of a presentation.
Okay. Okay.
That's it.
Thank you
Hey,
so much.
this is Janet. I'm uh, with the Older Adult Services, and I agree with the Florida Health Department. Those reports are wonderful because you can separate it out by zip code. You can also separate out by age grouping
Yeah.
the data that they have. So I use in my uh, producing of data results, I use them a lot.
Awesome. Thank you. Thank you guys. All right, let's go back up here and we're going to talk about some mental health rates. Um, so we are comparing again Beaches Action Collaborative footprint to Duval County overall. And we have uh, this is what I joked about at our last back meeting is that people are just happier at the beach, right? So we have less percentage of people who are reporting more mental health over Duval County. We have a little bit less people who are reporting that they've been diagnosed with depression as a percentage of the population. We have fewer results who are reporting feeling that they're socially isolated, as well as, oh, thank you for sharing that link, Glenwood. Fewer people saying that they're lacking social and emotional support among adults. And then I added in here also just kind of some trend line data around poor mental health of folks at the beach and how that has, even though it's right up here lower than Duval County, that number has kind of increased over time from 2014 to where we are today, about, let's see, couple percentage points up. But as you can imagine, as more people have become familiar with what it means to have poor mental health, that could also influence some of these numbers rising. This also is a trend line around people who have been diagnosed with depression among adults and how that has changed at the beach. So the data here goes back to 2019 up to 2023. So 2023 is 19.4% versus about 20.3. So that's remained relatively steady. Oh, this one I did not finish, so we're just going to skip that one. Just going to pretend like it doesn't exist. All right, and last but not least, certainly we're going to talk about healthcare access. And Jenny and I and our whole health cohort have talked a lot about healthcare access, and that the data that at least I have available to me doesn't really paint the full picture of what healthcare access looks like, right? There's so many different components of healthcare access, and the data that we have here isn't inclusive of all of those variables of, public and private insurance rates, utilization of ERs, utilization of the social safety care net and other things like that. But we're going to cover just a few data points that give us kind of a general picture of what health access is like at the beach. So here we're looking at hard numbers of people who are insured and uninsured at the beach. So we have about 8,000 folks who are uninsured. We have a map here that's going to show us people without insurance. Now, this is by zip code, where we have kind of larger uninsured rates on the other side of the intercoastal versus actually folks who live at the beach. And then we're going to take a look at some of the local health provider ratios as well. And so we see here the number of physicians, the dentists, OBGYNs, optometrists, mental health providers, pediatricians, geriatric care providers versus the total population at the bottom. So you can kind of see here the variation. So that's all the
Can I,
data that I
Allison,
get.
can we go back to that number?
Sure.
Those data don't look right to me.
Mm-hmm.
Um, so this is including 32224.
Mm-hmm.
Um, primary care physician, that's the total number of primary care physicians at the beaches.
It's a ratio, I believe, number of physicians compared to,
You're looking at specialists, and
right.
there's no specialists on here that I see.
Mm,
Um,
you would probably know better than me.
yeah, no,
Period.
I don't think these data. I'd look at them again because um, there's Baptist beaches. They have a lot
Sure.
of physicians.
Mm-hmm.
Um, Mayo Clinic, we have 700 physicians now, and that's at
Mm-hmm.
32224. So
Mm-hmm.
these numbers, there's something missing in these numbers.
Yeah. Yeah, the data source for this is and it's the National Physicians, I can't remember all of the breakdown of the source, but yeah, we can take a look at
Yeah,
that.
it's
Absolutely.
the national provider,
That's it. National
the
Provider,
national provider.
Physician Provider Enumeration System or something like that.
Yeah,
Could it be skewed based on like where they're registered? I mean, is it pulling like where they're getting that MPI number versus
well,
like where they practice?
we're
Yeah.
all registered at 32224 for Mayo. I mean I just it'd be interesting to look at this again.
Hmm. Yeah, we can take a look at
And I'm surprised to see, for example, um, pleasantly surprised, but 195 mental health providers at the beaches.
Mm-hmm.
I mean, that seems way, way higher than I would have thought.
Right. Mm-hmm.
And like always, you know, you can't make good decisions with data that are not accurate. And if these are right, then we have to understand better, I think.
Mm-hmm. How?
Curious with the mental health if people are providing virtual therapy, if somehow they're also registered to cover this
Mm,
county, even though they might not live in and really have an office in the county, but they could be out of state or they another part of Florida, but they provide
mm-hmm.
virtual therapy.
Yeah.
And there's a
But-
couple groups that have quite a few, like Elbow Tree and Ellie. I don't know how much that leads into 194 total, but there's a
Mm-hmm.
good chunk just in those two offices that I know of.
But we're always, Joshua, we're always hearing about there are not enough
Yeah,
providers, right? I mean, here it says there are almost twice as many mental health providers as primary care, and that just can't be right.
yeah, that seems interesting. I agree.
Yeah, you guys aren't the first group to question this data set. I think, Jenny, when we talked about this for Baker County, we saw that it listed one, what was it, one pediatrician.
I think Baker and
And
Putnam were like really off as far as, yeah, realistic numbers. And with mental health too, I think of how many private practice people who have their masters in social work, I just think of a lot of people down that path. I don't know. I guess the source would be very interesting to me too, just to know more about what
Mhm.
qualifies for these numbers and where they're being sourced. I mean, I see the source, but like, is it because they live in that area and they have a license to be a therapist,
Mhm.
or they practice in that area? Some doctors might live in different parts of the county geographically. Like, where does that number
Mhm.
live? So. But I know a lot of therapists personally who don't practice, or they work for the schools. I mean, there's like a lot of different buckets. So it's not surprising, I guess, to see that big mental health provider number. I think it needs to be broken down a little bit more. So like, who are they?
Right. Right. All right. I'm just gonna pull that up on my other screen really quick and let's take a look at we can answer these questions in real time. Let me bring this over here. Okay, so the author is our Center for Medicare and Medicaid Services. And again, yeah, that national plan and provider enumeration systems. We were almost there, David. We almost got it right. This is looking at the pediatric care physicians by sex, so it's not exactly the same data, but it's very similar. So count of clinically active pediatric care physicians by sex. So if we wanted to look at that, we could add a gender differentiator. Uses blah blah blah. So this would be any provider with the following taxonomy codes were counted. So pediatrics, adolescent medicine, and all of these codes, which probably mean more to you all than they actually do to me.
I just wonder, and David, maybe you could clarify because I'm not that familiar with provider numbers, but like a lot of my primary care doctor practices at the beach and practices at an office at Atlantic Boulevard and then has a practice over in Orange Park, like where does the MPI show up in all of those geographic regions, or does it
I,
have a home base? Like
I
how does
think
that?
I don't know. I think there's a home base, um, but I'm not. I think there's a home base because I practice in Minnesota and Arizona, and I have numbers in each of those places, but my primary is listed as here. But to your point, I don't know that.
Mm-hmm. Yeah.
The other thing that um, it's interesting. So when you go through Allison, the
Hmm.
description that you just went through. So
Yep.
this lists a lot of other, um, yeah, that lists a lot of other specialists
Right.
that aren't listed in the data that you showed,
Right.
like
Right.
ER. It just has
Right.
primary care and then a couple others, but
Right. This is a
yep,
aggregate. So what they're
yep. No,
calling
I understand
pediatric
that, but
care.
I'm
Yeah.
just trying to figure out. I think we're all trying to help
Yeah.
sort through where these numbers are.
Hmm.
The one thing I'll say that, and Josh, uh, I'd be interested in your thought of this. We hear all the time, right, that there's a mental health epidemic, suicide epidemic.
Hmm.
Um, and if you look at the graphs that you showed, Allison, if you
Hmm.
look over that 10-year period, there's noise up and down, but the overall rate is very similar and it's not gone
Yeah.
up. I was really surprised to see that. Is that what
Yeah.
is that surprising anybody else?
I when we do our city of Jacksonville grant application, I try to look at those kinds of numbers. And one thing I found, well, it's not on that chart, and I think somebody else kind of pointed out, like they'd be curious about what it looks like versus the state or versus the nation. And over 20 years, so going back to 2004 up to 2023, Duval as a county was higher than the state and nation 17 out of 20 times. And even if it went slightly up or slightly down, as you were saying, um, the overall trend is it's still higher than the state as a whole or the nation as a whole. I've never, I know somebody else was trying to pinpoint maybe things having to do with like a housing crisis or COVID or big, societal events that could impact a lot of people. Um, I guess Here Tomorrow being such a young organization, as you know, David, we started in 2021, already after the pandemic. I've never gotten that deep into it because we already were after all those events. And But I think the other thing that I mentioned to Allison, it's difficult to obtain, especially as youth numbers. Not to change the subject, but there was Duval County used to be part of the Youth Risk Behavior Survey for about 12 years, and those numbers were very alarming, I would say, compared to the state and the nation. And we've kind of lost that data because Duval County doesn't participate anymore, and so just trying to find those kinds of trends, I think, has been very difficult. But yeah, I don't know. I'm definitely not an expert in saying why it's a little higher a certain year, a little lower a certain year. But I just know overall, when you put it next to the state and next to the nation, it's almost always higher.
Thanks, Josh.
Yeah, thank you.
Any other thoughts that we want to share? Reactions? Okay. Well, I'm going to share um, our upcoming events with you all. Let's see if I can open it. We have a few upcoming events, including starting next week. Let me pull this up. Share my screen. We have our membership corner coming up, where we're going to talk about the board bank that we've established and kind of walk people through how to post positions to our board bank, as well as encouraging different leaders in the opportunity to post their profile so nonprofits can reach out to them.
And I have to say that works because we have one of our board members who is outstanding and he found it on your board bank. So thank you.
Awesome. Thanks for that vote of confidence, Lori. We have another session on February 11th called Board Roles and Responsibilities. That's free for members, I believe. We have another session on February 11th called Office Hours. So this is just a data session, open session. Anybody can join. That's a nonprofit center member, and we can just chat data. So it's an open session for 1 hour. Like Joshua, if you wanted to join and wanted to ask, what specific metrics could you help me find? That's in your database to tell my story about a really specific geographic region. I could help you do that. Or, any other types of theoretical questions or conversations we would want to have. On February 13th, we're having our all-member gathering, which all members of the Nonprofit Center are invited to attend. It's always a fun time where it's free. We have lunch. We're going to do some Family Feud style games this year, and our theme is family reunion. So hopefully it'll be fun and not just educational. We're also going to share our new strategic plan with you all that came out of our couple month long strategic planning process last year. And then we've developed a new series we're calling our Civic Action Series, which is helping nonprofits understand best practices in advocacy and really have really specific conversations around that. So the first one is calling Redefining Civic Engagement and the Power of Nonprofit Assets. That's going to be on February 17th. And then obviously we always do a survey at the end. So if you all would like to give your feedback about today's session or about the dashboard overall, I'd love to have it. And I'd love to see you all next week at our in-person session at Palms Presbyterian to review all of the feedback that we received and chat about what are our next steps for the beaches dashboard. So,
Allison, is that next week? I'm going to be out of town. Is that going to be videoed?
it'll be an in-person session, so we're not going to plan to record it. No, David, I'm sorry.
Okay.
Yeah. But I will be sending out all the recordings this afternoon for all the sessions that we've had this week to all the folks on our beaches distribution list. So
And
you
what
guys should.
date is that? I'm sorry.
I believe it's on Thursday. Let me double check. Yeah.
From 12 to 1
Yes.
on the
12
5th?
to 1 at Palms at 5th. Yes.
I thought it was the third. Is it the fifth? Sorry. Sorry.
Yeah,
It's the third.
something. I
It's
have
the
a data
third
thing on the
June.
3rd and the 5th.
I bet the third at noon.
Well, my calendar may be wrong. Whatever's posted on the Nonprofit Center website is going to be correct. So let's look at that real quick. Calendar. We have beaches data convening February 3rd. It's Tuesday. All right. Good thing you guys told me that because I would have showed up on Thursday and I would
And
have
that's at
I
Palm.
missed it.
terrible situation. Yes, absolutely. Palms.
I love when you do that. That's where my office is.
I love Palms. It's a great venue.
Pretty.
And everyone there's so awesome. All right, everybody. Well, I appreciate you all so much. Have a great weekend.
Thank you. Nice seeing everybody.
Yeah,
Allison,
nice to
thanks
see
for
familiar
doing all
faces and
this.
some new ones.
Yeah, it's great.
Thank
Bye.
you.
You really did a
Bye.
great job, Allison. And I know I talk too much, but it's always great to interact with so many smart people. So thank you.
You're so welcome. I love meeting
Thanks,
smart people.
Allison.
Thank
Bye,
you.
all.
Well done.
Thanks.
Bye-bye.